Good morning. We have the great pleasure to welcome Professor Eytan, head of the Gastroenterology, Hepatology and Nutrition Unit at Sick Kids in Toronto, to talk about PIBD meeting that we are attending in Sorrento. So, Professor Wine, welcome.
Thank you, Jalil.
And tell us a little bit more about the session of the PIBD this year. Looks very rich in science and new news.
Yes, it's a wonderful meeting. The attendance is the highest we've ever had from many countries across the world. And certainly diet and IBD is a major focus. And I think it reflects the community, our patients, and the interest in this topic for this meeting.
Thanks a lot. One thing we heard over the last sessions was the challenges in getting new drugs approved and for pediatric population. In this era of drugs and difficulties of having new drugs, how you see nutrition?
So certainly we're very limited with the number of drugs that are approved for use in pediatrics, and even in the adult setting where they have many drugs, there still are challenges. We're far from being in a situation where we have perfect solutions, and that's exactly where nutrition fits in as the safest treatment that we have for pediatric Crohn's disease, certainly for mild to moderate disease, and the experience that's been gathered over many decades is something that must not be forgotten even when we have these new drugs appearing. And I think that one of the main roles that we still have is using this as the #1 choice induction therapy for mild to moderate luminal Crohn's disease, whether it's exclusive enteronutrition or Crohn's disease exclusion diet plus PEN, but also as an adjunct therapy to other treatments. We're gathering more experience with that and certainly seeing positive results.
Thanks a lot. I'm thinking here about your recent publications and recent work, that part of it was presented when it comes to identifying the right patients or the best solution for the patients. How you see the perspective in getting some let's say predictive values of some biological testing, microbiome testing, and so on.
A very important question. So when we have options, we need tools to select the best option. And I think for that, there are disease factors such as disease location, severity, where, luminal disease, of course, as opposed to perianal disease, I would not use nutritional therapy for perianal disease. Severe cases, I would use it as an adjunct, but not alone. And the location itself, I think for predominantly colonic disease, we're not going to see the same level of effect, whether it's compared to ileocolonic or ileal disease. Those are some of the disease factors. Patient factors are very important as well. So we know that age is an important factor, and we do see good success in children, less so in adults. But the ability of the family to accept it and the education that they're willing to receive are going to be important for that. And then there are additional biological factors, and I think that that's what you're focusing your question on. So are there predictors that we can identify? So we've done some work looking at clinical predictors, but some of the recent work that we've done and others as well have looked at the microbiome. So is this microbiome the microbiome that reflects a disease process that is open to change, is one of the questions that we're asking now. And at least some of the preliminary data we have from the diatomic study suggests that that is the case, and we can predict response based on microbiome, metabolome, and other data. This will, of course, help us focus the best treatment for each patient individually.
Thank you very much. Maybe a last point that came also from many discussions within the session is about the management of the patients, the multidisciplinary team, but also how you can better manage the transition from pediatrics to adult patients. How you see an optimized way to ensure that also patients, when they are moving from what we hear and what we know, a very well-controlled management when they are in pediatrics, but then when they evolve, how we can still ensure for them good solutions.
That's a very important point. So #1, if you look at the success of EN or CDD plus PN, it very much depends on the setting, the location where it's done. If you have individuals who've had the correct training, have the experience, who believe in this, and this really needs to come, first of all, from the physician, who has to be dedicated to this and educated about it, but of course the dietitian, nurses, and other health professionals are there to support and allow this to happen. And the best success you're going to have, like any treatment, is if you're a professional and you will invest the time and effort into doing it in a professional way by having the right partners around you. And it's not only at the time of initiation. Like any other treatment, you need to follow your patient. You have to make sure that they're adhering to the treatment the same way, like you ask whether they're taking the drugs, diet is the same. The transition to adult care, we have had challenges in the past where adult physicians were not educated about this, were not open to the idea. That is changing. It's changing differently in different places. I can tell you that a lot of the colleagues that I've worked with in the adult setting, they come and say to me, you need to teach me nutritional therapy because my patients that go to them, they say, new doctor, I want the same treatment. So we're definitely seeing that there is more understanding of that. And when I go to some of the adult meetings, ECHO, there's so much interest in this because their patients are requesting it. And once that's there, the transition is working better. There are some places where this is a gap, but it's our, I think, very important mission as physicians, especially if we believe in this, to spread the word, encourage others to take initiative, including the adult teams. And the involvement of dietitians in the adult setting is usually very different. They and their patients will benefit from this as well. So this is something else that they can learn from us.
Thank you very much. Thank you. Thank you for your time. Thank you for the great discussion.
Thank you.
And of course, I wish you a great conference.
Thank you very much.
Thank you.
Thank you.